So let's talk a little bit about pinching in the front of the hip. It's a very frequent complaint that I have here in the clinic. Definitely related to pelvic floor. So as a pelvic floor physical therapist, I see it a lot. One of the major complaints as we bring our hip into full flexion is we start to get this pinching in the front of the hip. So there are several reasons for that. I'm not going to go into that into this video, but what I'd really like to do is just keep it short and concise and just give you some quick tips to help pull that femur back into the socket so that you don't get that pinching in the hip. So we'll just do like a starting position so that you can kind of see a little bit of before and after. Hopefully that'll work on me because I do have a little bit of pinching in the front of my right hip. So I'm hoping that you can see maybe the changes after we do this little technique. So if I get into this Z sitting position or kind of a 90-90 upright seated position, you can see that I have one of my legs is in external rotation and one is in internal rotation. And so this right hip is more into internal rotation. So I'm getting that pinching in the front of my hip. So that is the limitation that or one of the limitations that I'm having here is that I'm limited into internal rotation. And most likely that's because the ball of my femur, the head of my femur is shifted forward slightly in the socket. And so that's what I'm going to work on trying to shift back. So this technique is often called just an iliacus pullback. And this is one of the exercises that I learned from Sarah Duvall's classes. I think it's a PRI technique, but really it's just using the strength of the muscles to help shift the ball of the femur back into the socket where it sits more comfortably and allows for better range of motion on your hip. So just take a mental note here where my hips are sitting. You can see that I'm not completely low to the ground here in the midsection, and then I'm having a little bit of difficulty just sitting in that upright position. Now, if we compare it to the left side being in internal rotation, you can see I'm much more relaxed here through the middle section, and I'm able to sit more comfortably. I'm not completely upright, and I've definitely got some limitations on this left side too, but it's much more comfortable for me, and I can sort of just sit. I could sit here for several minutes without it being an issue. So let's get into the exercise. So what you want to do is get yourself a bolster or something similar, something that's long enough to go between your knees and your ankles. You could use a couple of yoga blocks. That would work nicely too, but you don't want it to be too soft and squishy. So I'm going to get a towel, just something that's not too high from my head, just to help for spinal alignment. And I'm going to get into a sideline position. All right. So once I'm in sideline position, I want to put the bolster between my ankles and my knees and bring my hips up into that 90-degree flexion. Then I'm just going to relax at the top. Just try to be comfortable. So get as much padding for your neck as you need so that you can relax your shoulder here. So we don't want to create tension in any other position. So I've got the bolster placed between my knees and my ankles. And if you find this exercise to be difficult, you could get something a little bit wider, and it would probably make the exercise a little bit easier. So once I'm in position, what I'm going to do is I'm going to engage the core a little bit. So I'm just going to give myself a nice exhale, activate my core, and lift my ribs up off of the ground just a little bit so I can squeeze my hand in there, right? So, and that again helps to better align my spine and my body position. Okay, so once I've got all of those in place, I'm getting engaged, lift my ribs up off the floor. What I'm going to do is I'm going to push down with my top leg to activate those adductors, those muscles in my inner thigh. I could do just a quick check, make sure my glutes are still nice and squishy because I don't want to activate those. And my hip flexors, they should be nice and squishy too, because I'm really just targeting my hip adductors, okay? So core, ribs, squeeze, and then I'm gonna pull my femur back into the socket. So just a nice gentle pull. It's a very small movement. And I'm gonna feel that right in that hip socket. I'm gonna hold for 3 to 5 seconds and then bring it back straight forward. Meet my other knee, or maybe even go just a little bit past that knee, just to give me a little more room the next time. Relax and reset. So engage, we'll lift those ribs, press down, bring on the adductors, and bring that femur straight back. Nice. So I can feel that right there. And so I would do this 10 times each leg. And just for the sake of the video, I'm not going to do 10 times on each side. So we might not see as good of a result in the before and after like I was hoping, but you get the idea. Do 10 times on the left leg, 10, flip over, do 10 times on the right leg, and I think you'll see a little bit of that immediate change in the movement of your hips. And so if I come up from that position, scoot my bolster out of the way there, and position my left leg in internal rotation and then my right leg in external rotation. That does feel nicer on that left hip than it did in the beginning. Now this wasn't the side that was as stuck, but still I feel much more upright. I feel much more comfortable with that leg in that position, and I can hang out here for a bit. So let me go ahead and check that right leg. I didn't do the pullbacks on this side, so I don't expect to see much of a change, but I have been doing some movement on this mat, so let's see. So you can see that's still pretty stuck. Like I feel that right in the front of my hip. So another strategy that I like to do, sometimes I'll do these back to back. It just depends on how much relief that we get from this 90-90 pullback. And I think I might do a couple just on this right hip, just to see if we get some noticeable change in the immediate, because a lot of times we really do. So I'm going to position my bolster and my legs. Relax into position here. Okay, engage. Scoop my ribs up off the floor just a bit. Squeeze and pull straight back into that socket. Glutes are squishy. Flexors are squishy. So I'm just feeling it right here in the hip. Relax, bring it back. Squeeze, lift my ribs. Pull that straight back into the socket. You might notice that I'm holding my bolster, so if you are using yoga blocks, you won't have to hold. But since this is round, it likes to wiggle a little bit on me, so I like to just hold it to keep it from wiggling, and then I can feel a better pull in the femur, the ball in the socket right there. That was 3. I'm gonna go ahead and do 5 on this leg, because I'd really like for you to see what an immediate transition it can make. You're feeling that pinching, and the pinching in the front of the hip, that's not something that we necessarily want to ignore or push through, because it can really set you up for some injury to that hip. So like a labral tear, something like that, if we just ignore what our body's trying to tell us. All right. Nice. So I'm going to get back into that Z sitting position. Get that right hip into some internal rotation. And that is much better for that right hip for me. A little bit lower here, but definitely less pinching. I feel like I can sit up more upright at this time, and this leg feels a lot more comfortable. So it's not exactly where I want it to be yet, because I know I've still got some work to do on it, but it is much, much nicer, and I'm less likely to injure that hip if I'm doing some other higher level activities. So I'm going to show you the second technique that I'll use if I don't get as much relief as I want when I'm working with my clients. We'll do the pullbacks, and that will certainly be part of their homework assignment. And then this is another one that I like to do. So we're just going to take a stretchy band. So whatever you have, but I've just tied up a couple of TheraBands here. So I'm going to wrap it around the hip that I'm focused on, right in the socket. I'm just going to step forward till I get a little bit of tension on the front of my hip. And then from there, I'm just going to do, there's nothing magical about the number 10, but I'd probably start with like 10 like squats. And they can be as low as you're comfortable doing. So just sort of move into that squatting position. And I've got this tension on my femur as I work into a squatting position. Keeping my core engaged. Keeping my feet in contact with the floor. So getting all the benefits of this exercise. Okay. Now let's recheck that right hip. I'm just going to slide that off. And then we're going to move into internal rotation then again with this right hip. So that is going to be, get my right and my left mixed up here. There we go. So yes, much nicer again. Still feeling pretty nice on this right hip. Got just a little bit of kink going on still that I know I need to work on, but so much better. So I feel so much safer than trying to do a higher level strengthening or plyometric exercise of some sort, knowing that that ball can sit where it likes to sit in the front of that, in the femur, so it's shifted back. So try these exercises if you're getting the pinching in the front of your hip, and do it consistently. So do the 10 reps on each leg or the leg that you're having the pinching every day for a week. Just do a challenge. Give yourself a challenge. I'm going to do that every day for 7 days and see if that doesn't make a difference in the pinching in the front of your hip. If that doesn't resolve your issue, then you may want to go see a physical therapist in person so that they can address any other issues that you might be having in order to resolve that pinching. So I hope this helps. Give it a try. Leave me a comment if you feel like it did help you, and please share this video with anyone that you think might benefit. Hope you're having a great day, and I'll talk to you soon. Bye.